Today, this is a very important topic, and this topic is even more challenging for our veterans who struggle with mental health issues upon their return from the service they provide to our great country. About 30% of military personnel deployed in Iraq and Afghanistan have a mental health need requiring treatment. However, we know that less than half of those in need do receive any treatment. If that isn't disconcerting enough, the Department of Veterans Affairs estimates that approximately 22 veterans and service members die by suicide each day. We know that technology, including social media, has received attention recently from topics ranging from data leaks to misinformation. Yet, we have also come to live in a world where digital technologies have become part of our day-to-day life, and we live with it every second of the day. Technology and data, when used correctly, can make a huge difference to our lives and the many lives that struggle with the need for wellness and the need for betterment in life. In the light of this, today's topic on smart nudging and the usefulness of digital technologies to address challenges with mental health and prevent or minimize suicides is a very relevant one. You will hear from our speakers today, a very distinguished group, from those in the forefront of providing support and care to improve mental health, to those in academia who are helping understand how to engage human behaviors for this same cause, and technologists who have designed platforms and data analytic tools for providing better care and management to drive each and every one of us to a world of wellness. Before we go further, let me introduce our co-host, Ashley Mehta. Ashley is a chairwoman, CEO, and president of Nolij Consulting, a woman-owned small business located in Northern Virginia. Nolij is a solutions-focused healthcare IT services company that specializes in digital healthcare modernization for the military, public, and commercial sectors. Ashley founded Nolij Consulting in 2013, and before establishing Nolij, Ashley worked with some of the top 10 consulting companies from 2009 to 2013 in the capacity as a chief of staff. She serves on the board of directors of the Women Veterans Interactive Foundation. Ashley holds a BA in marketing from the University of Ohio. Let me turn it over to Ashley to introduce the rest of our speakers and to give them an opportunity to tell you a little bit more about what they do and how they try to address this problem. Ashley?
Yeah, thank you, Dr. Sukumar. Welcome everyone to this webinar. We're very excited about this. We kind of got together because Nolij had partnered with OSG and IBM on a couple of opportunities within the Department of Defense. And it was actually Suicide Prevention Month last month. And we all kind of got together and we said, you know, it would be great to be able to do a webinar, introduce our technologies. We have an outstanding panelist here, Dr. Rinad Beidas, that has a lot of expertise in nudging, and thought this would just be a great opportunity to get people together and talk about how nudging technology can prevent suicide. So thank you so much, Dr. Sukumar. And I would like to go ahead and introduce the beautiful minds of our panelists here today. I would like to first introduce Dr. Rinad Beidas. I hope I pronounced that correctly. Dr. Rinad Beidas is the director of Penn Medicine Nudge Unit. She is the founder and director of the Penn Implementation Science Center, an associate director of the Center of Health Incentives and Behavioral Economics. She is an associate professor of psychiatry, medical ethics and health policy, and medicine of UPenn. Dr. Beidas's program focuses on implementing evidence-based practices and into routine healthcare delivery to ensure that scientific discoveries realize their potential and improve people's lives. Her research spans disease areas such as mental health, cancer, and suicide prevention. So I hope I did her justice. So thank you so much for joining today. Our second panelist is Mark Newsome. He is just got promoted, congratulations, Mark, to the Vice President and Senior Partner at IBM for Federal Healthcare. He is, with IBM Consulting. In 2016, he was part of the IBM Creative Leadership Team that built a new neuroscience-based digital solution as the first iteration of IBM's Thrive 360 mental fitness platform for the Department of Veterans Affairs. This app called Get Results in Transition, which is called GRIT, was specifically designed to help veterans and reservists and other service members. So lots of accomplishments, Mark, and thank you so much for attending this webinar. In addition, I'm so sorry, there's another paragraph here, but prior to IBM, Mark served 25 years in the US Army as an Army Medical Service Corps Chief Financial Officer and Army Medical Congressional Budget Liaison with ASI at the Pentagon. He also serves on Board of Directors for Veterans and Global Leadership and the US Chamber of Commerce, VA, Veterans Affairs, and Employee Wellbeing Work Group. So thanks again, Mark. Ginger Miller, I've got my WVI pen on here. Ginger Miller is, wow, she takes it all up to the White House, fights for women's veterans. She is the CEO of Women's Veterans Interactive and former homeless service disabled Navy veteran. Ginger started Women's Veteran Interactive, WVI, in 2011. WVI is a leading member-based nonprofit organization for women veterans and has supported more than 3,500 women veterans since inception. Ginger currently serves as the chairwoman of the Advisory Committee on Minority Veterans at VA, and she also serves on the advisory board of Northwest Federal Credit Union. Ginger has received many awards, including the Department of VA Center for Women Veterans 2019 Trailblazer Award. And then Dr. Sukumar. He is the founder and CEO of OSG. Prior to founding OSG, Sukumar spent over 20 years in academic, teaching marketing strategy and advanced analytics at top MBA and PhD programs around the globe. As a renowned thought leader in the industry, he has been interviewed and quoted in notable publications such as Forbes, HBR, Inc. magazine. Dr. Sukumar has MBA and PhD from the University of Pittsburgh and marketing and BA and BS mechanical engineering from the Indian Institute of Technology. So thank you so much for attending this webinar. And last night, my daughter read your bios and she started hitting the books. So a lot of competition out there. So thank you so much. So I guess we would start with Dr. Beidas, right? If you would like to kind of lay the groundwork for the webinar and talk about the behavior insights and decision-making, what is nudging technology, and how does that choice affect the architecture of nudging?
Absolutely. So I'm going to go ahead and share my screen. Thank you for that incredibly kind introduction. Let's see if the magic happens. This is always the moment where we all sweat. All right. Can somebody give me a thumbs up if they can hear me and see my slides? Thank you very much to my co-panelists who gave me that verification. So my name is Rinad Beidas, and I'm so excited to be here with you today. I'm really going to just start us off with a high-level overview of what nudges are and how they might be used to transform mental health care delivery, particularly with an eye towards suicide prevention. Yes, Dr. Sukumar.
Dr. Beidas, we can see two of your screens. I don't know if you're on a double monitor. You may want to just modify that.
Do you see, which view do you see?
I see your first slide and your second slide, like two
screens. Oh, you see presenter view.
Yeah.
How's that?
Works perfect. Thank you.
Awesome. Great. Okay. So let me go to the next slide. All looks good to you? Great. Okay. So the first thing you may be wondering is, what is a nudge? You may have heard this concept, it's been widely popularized with the book Nudge, which just came out with its final edition. We'll see if it's actually the final edition, led by authors Dr. Richard Thaler and Dr. Cass Sunstein. Actually, Richard Thaler won the Nobel Prize in Economics in 2017 for the concepts that I'll be sharing with you all today. But kind of put simply, a nudge is a change in the way that choices are presented or information is framed that changes people's behavior. Importantly, and this is a point that I really want to underscore, it doesn't restrict choice or take away choice. And nudges have to be transparent and not misleading, easy for people to kind of opt out of and aligned with the welfare of those being nudged. And so folks who design nudges are known as choice architects. You may have also heard that terminology before. And so the very cool thing is that there's a really large body of literature that suggests that nudges are low cost, they're scalable, and they're effective ways to design to support humans in engaging in healthy behaviors. So that's kind of the big picture idea of what a nudge is. Now I'm going to give you some actual examples, some of my favorite examples, so that I can bring this to life. So what you see pictured here is actually a subway station in Stockholm. And back in 2009, Volkswagen was doing an ad campaign, and they repainted these stairs to make it into a musical piano, including sound. What would you choose if you were on your way to work? The escalator, or would you try to have a chance to play chopsticks on your way to work? You know, that's a nudge, nudging folks to take the stairs instead of the escalator. And during a one-day test of this, 66% more people chose the stairs over the escalator. Here's another, maybe my favorite example. If we were in a more interactive chat, I would ask you if you knew what this was, but I'll just go ahead and tell you. This is the urinal fly. The story, and you may not be able to see that small fly in the urinal, which is why I'm blowing it up for you. But the story goes that it's difficult to encourage men to urinate in such a way that avoids mess, which of course is a problem in public bathrooms. So I do happen to have an 8-year-old boy. I can verify that story. We could really use a urinal fly in our house. In the early 1990s, a fly was etched into urinals in this airport in Amsterdam, reducing spillage by a large percentage. Another great example from London. Here, smokers are encouraged not to litter by asking them to vote with their cigarette butts on who the best soccer player is in the world, Ronaldo or Messi. Evaluations suggest that this reduces litter by up to 46%. And you can see people are voting with their cigarette butts. Finally, a digital nudging example before I get to a little bit more of the meat, just to really give you a flavor for this. Have you ever gotten stuck in a binge session on Netflix? That's intentional. Netflix is designed to nudge you to continue watching. It just rolls right into the next episode. So to summarize, there's some key design principles of nudging that has been popularized by what we call the EAST framework, which the UK Behavioral Insights team have put forth. So the first design principle is make it easy. Think of our Netflix example as a really great illustration of that. The default is just to roll into the next episode. The second principle is to make it attractive. Think of the piano stairs. It's fun and nice to hear and look at. The third principle is to make it social. So think of voting with cigarette butts. It's a community voting. And then the fourth principle is make it timely. Think of the urinal fly. It's there right at the right moment to encourage proper aiming. Of course, each of the interventions I just described in the slides before may incorporate multiple principles, but tried to highlight the main thing. So moving on past kind of this idea of what actually is a nudge, I want to talk to you a little bit about the situation in the world right now. And Dr. Sukumar already touched on this. I'm actually a practicing clinical psychologist, and I can tell you that this headline is real. This is a study that was published in The Lancet, finding that cases of anxiety and depression have increased dramatically with COVID-19, particularly for women. So simply put, we have a global mental health crisis on our hands. We had one before COVID, and now it's much worse. I'd argue the opportunity is really ripe to apply behavioral insights and nudges, which is what I was talking about earlier, to mental health care. particularly with the advent of all the digital technologies that are available and the ability to use big data to understand behavior. In other areas of healthcare, there's been lots of activity in applying these concepts to health behaviors like smoking, medication adherence, physical activity, but we haven't quite seen the same attention in mental health care. So, one key question is whether or not we can apply these concepts to digital nudging to reduce suicidal behavior, which is the reason why we're all here today. And I would argue that suicide prevention is one place where we can be particularly impactful. The graph that you see on the slide is a graph of suicide rates in our country from 1999 to 2019. On the x-axis, you can see the dates. On the y-axis, you can see the deaths per 100,000. And what you'll see is that the rates have been steadily increasing over over that decade. Now, I will note, and you may see this in, if you go to look to the literature, is that the crest seems to be at 2018, and initial data from the pandemic suggests that overall rates are not kind of continuing to increase in the same trajectory that they were before, although that may change as the pandemic continues. But when you look at specific subpopulations, for example, Black or African American youth, we see continuing increases in a steep trajectory. Either way, the current suicide death rates are much too high, and we must deploy all the interventions that we have at hand. So I'm just going to pose a couple of thoughts, food for thought, that I hope will spark some conversation about how we might apply some of those concepts that I showed you earlier in thinking about suicide prevention. And some of these are just ideas. Some of them have actually been tested in non-treatment seeking populations or in individuals experiencing suicidal ideation. And so this is just really to give you a flavor. So the first idea might be for somebody to receive a support phone call as the default if certain behaviors are passively detected by their smartphone. So rather than having to pick up and call the suicide hotline, a call is made to that person's phone when the phone picks up that there might be problematic behavior going on. A second, and this has actually been tested and the citations are below, one could think about using a social norm nudge in a text or an email to increase use of suicide intervention. So if you say something like, 95.6% of people believe you should get help if you're suffering from anxiety, and then offer a resource, you see higher uptake versus just saying, here's a resource. Another idea would be to use framing to increase the likelihood of seeking out online coping skills. So if you tell someone, you should check this out so you could help a friend, versus you should check this out because you need coping skills, you see higher uptake when it's socially framed. Now, I do a lot of work targeting clinician behavior. So another idea is to nudge clinicians using the electronic health record, which is a digital technology, to talk about means safety. And means are the ways in which people attempt suicide in routine health visits. And that's actually work that our team's doing. Another idea would be in the electronic health record to put suicide screening and assessment buttons at the top of every EHR note, electronic health record note, to really make it salient and timely. And then finally, and these are more structural interventions, creating friction. So it's the opposite of a nudge between accessing lethal means in places where people live, work, and play. So those are just some ideas. And to summarize, because I'm out of time, nudges are low cost, they're scalable and effective. And I think the time is ripe to apply these concepts to mental health care, particularly with regard to suicide. But I'll leave you with one thought, which is that nudges, digital or not, must be deployed in parallel with evidence-based suicide prevention strategies. So nudges alone are not going to get us out of our global mental health crisis. We also need to be deploying and increasing the capacity of our infrastructure to provide evidence-based care. So thank you very much. I'm going to stop sharing now, and I appreciate the opportunity to share my thoughts.
Yes, thank you so much, Dr. Beidas. That was excellent and very interesting. So the next panelist, we'd like to have her speak a little bit about her hands-on experience with women veterans, how she's helping them, and how she thinks maybe nudging technology might be able to reach out to those in need. So go ahead, Ginger.
Thank Thank you so much, Ashley. And like Mark, I just recently received a quote unquote promotion. So I'll just go ahead and share that. Last month in September, President Joe Biden appointed me to the USO Board of Governors. So I'm super excited about, having the opportunity to serve veterans and military families at yet another level. I'll just talk a little bit about Women Veterans Interactive and the presentation before me. I'm really intrigued with this whole nudging, but let me tell you what I do at Women Veterans Interactive first, and then I'll get into that portion of it. Women Veterans Interactive is a national membership nonprofit organization that has supported service women and women veterans for over 10 years. Women Veterans Interactive is a solutions-driven nonprofit organization focused on outreach and engagement. We enable and empower women veterans with the tools and resources needed to achieve post-military success. We accomplish our mission by operating on 3 pillars: wellness, transition, and safety. And, for today's discussion, I think, the wellness, transition, and safety, it all comes together nicely when we're talking about suicide amongst veterans. We heard the statistical data, so I won't get into that anymore, but I'm a strong believer that if we have 1 veteran a day committing suicide, that's 1 too many. Why are our veterans committing suicide? The transition is difficult for some veterans. Some veterans are feeling alone. Some veterans feel that they can't make it in the civilian sector. We have those veterans who have, participated in several wars that we have had in this country. And it's just difficult, to come back into the civilian sector and quote unquote, get yourself together without the proper resources. A couple of programs we have at WVI, we focus on women veterans who are homeless, at risk of being homeless. We have a financial literacy program. But even with all of the programs that we have, if our main undergirth was not rooted in outreach and engagement, then we would miss the mark every time. And one of the things I realized is that through our outreach and engagement efforts, we have captured like thousands of women veterans in this net. And, a lot of whom along this journey have been suicidal. And it's sad to see, someone, especially a woman veteran with children, who is suffering from depression, anxiety, PTSD, military sexual trauma. And when they get to that suicidal state, sometimes it's hard to bring them back. And then there's other times, more often than not, just by being amongst your peers and other people that you have served with, it kind of makes the difference. But to the point of nudging, I'm very intrigued, with this whole nudging process, with using technology. If we can reach veterans at the right time through nudging and technology, then I truly believe we can cut down on suicide. I'm a big fan of social media. I'm a marketing, guru. I'm always on Facebook, LinkedIn, whatever. And I get nudged so much. So when you talk about nudging, like I never knew there was a terminology for that. Like I've seen something to come across like a pair of shoes that keep nudging me almost like every day. And I said, you know what? If I see those shoes come across one more time, I'm going to purchase those shoes. So I didn't know like that was a thing. So I'm saying to myself, okay, in the veteran community, a lot of veterans who are suffering from depression, they may not get out a lot, right? One of the things I noticed through the pandemic, when we did a pink and white empowerment virtual brunch, we did it every Monday from 12 to 1, from like May to June. We had women veterans showing up from around the country. Normally we would do this in person, but due to COVID, we had to make it virtual. The point I'm driving home is this. There were so many women who were hiding behind their computers, but would get dressed up every Monday to put that pink and white on, like to show their face. And then they would admit like, okay, I'm dealing with depression. I'm dealing with these issues, quote unquote, my computer and my smartphone is my best friend. So how do you combine that, as in the previous conversation, with proven methodologies? How do we combine that to really reach veterans where they are? And I think oftentimes the most, that's where a lot of service organizations miss it, because we want the veterans to come to us. A lot of times folks who are suffering from depression are not going to come to us. But if we had a way to get to them through something that I'm on this line here and I have my cell phone. So if I'm feeling any kind of way, I may not get up and go see somebody, but I may open my cell phone up to get on social media feeling depressed that day. And if I can be nudged, to go to the VA or to call that hotline, then, we're probably going to save a life that way. Thank you.
Yeah, thank you so much, Ginger. Really appreciate that. So Mark?
Thanks,
Go ahead.
Ashley. I appreciate that. And thanks to Ginger and Dr. Beidas. The experience that sticks out the most to me was around March of 2019, 3 p.m. in the afternoon. The message that I received was that Rob had passed. Rob had passed. I was a mentor to Rob. Rob was a retired field grade Army officer, had a great job at DISA, had a family, had pets. And the message comes that Rob has passed. Without thinking twice, I knew what that meant. I don't know how I knew, but I knew it wasn't a car accident. I knew it wasn't anything else that had transpired of natural causes, diseases. I was his mentor. I knew him. Each of us perhaps have one of those stories of someone who's seemingly thriving, but all of a sudden you find out that they decided to take the road out through suicide. Dr. Beidas mentioned that mental health is a global crisis. And she further extended that to suicide is a global crisis. When we look at those who stand in the defense of our freedom, it's a crisis. One a day, whatever the numbers may be, it's a crisis. It's one that we must address. It requires both the evidence-based medicine combined with the bold and audacious talents, prowess, and abilities that the IT community and science community brings. And that's where IBM comes in to be able to help solve in this problem. We were already on the road before I got the message about Rob. We were already down the road of trying to solve this problem from the 2016 Brain Trust event in downtown DC. Started with a simple question: how can technology help to prevent suicide? That was the question. That question was asked of the same not so hidden figures that put a man on the moon. It was asked of the organization that brings you a very good experience while you're watching the US Open. It was asked of the organization that allows you to enjoy your football experience at the stadium in Atlanta while watching the NFL. It's the same organization that the question was asked when you get ready to fly Delta Airlines, that are able to help them with their experience and out migrations on major scale. We put our heads together in conjunction with the Department of Veterans Affairs, and where we landed today is an app that puts help in the palm of your hands, in the palm of the hands, that device that everybody has nearly 24/7, providing capabilities and coping mechanisms to strengthen their resilience through social connectedness, to prevent social isolation, to provide them an avenue to be able to attack some of the social determinants of health, employment, housing, legal, finance, community, to provide them a 24/7 digital assistant of vetted resources out of the Department of Veterans Affairs. And then to give them a platform and a mind gym with some of the best neuroscientists and neuroscience-based medicine in the country to help them, just like you would go to the gym to improve your physical strength and your physical resilience, to give you a platform called the Mind Gym to help with your mental resilience. And so as we discussed today, it's a crisis that's a great call to action for us all to lean in and to help where we can. And I would venture to say that IT is working hand in hand and arm in arm with the evidence-based community to deliver the best of technology to help in this crisis and to answer the call to action for those who served in the defense of our nation. Bottom line is, this a crisis, and we must all lean in to help and resolve and prevent suicide.
Thank you, Mark. Very sorry about your friend. We also, give to Nova Health. And the other day we did attend a webinar and they were talking about how a lot of kids, are coming in with suicidal tendencies and maybe overdosed on pills or drugs or that kind of thing. And they said one of the things that they're very surprised by is the fact that they had incorporated some technology, into their continuum of care, and things that they wouldn't necessarily tell a doctor or a friend or a relative, they would actually put into the app. So then when the doctor would meet with them, they'd say, well, I didn't know you were abused. I didn't know this. I didn't know that. So I think a lot of times it's much easier for this generation to be able to put that kind of information into some sort of technology, right? So thank you so much. Appreciate that. So Dr. Sukumar, would you like to go next and talk about your Patient 360 app?
Thank you. And so continuing on that theme of technology and the use of an app, but more importantly, understanding the entire patient experiences along that entire journey. That's exactly what Patient X 360 does. It's important to understand that, we heard Dr. Beidas talk about nudging, personalization of that nudging. We heard from Mark about how technology can capture what people, how they feel. It also helps us get to that underlying behavioral motivations. And that's exactly what Patient X 360 does. In a very simple sense, this is one that allows us to bring forth what we know about the individual clinically, what do we know about this individual along their lifestyles on a day-to-day basis, their journeys, and to be able to bring this kind of data, to be able to create complete transparency along that journey in time. And that's very critical to make that data be available both to the care coordinator, perhaps even to the caregiver or the friend, and to the individual themselves, so that they can set the right kind of goals, so that they can set the right kind of motivations. Designing the nudge is an important aspect of this technology. And this is where we use interesting data algorithm that allows us to get to the heart of understanding what matters to this person. Nudges are not meant to be designed surreptitiously. Nudges are not meant to be designed suspiciously. Nudges that bring value to an individual to get them engaged need to be designed with their input. So Patient X 360 is a very simple app. It can be downloadable. It can be made part of any hospital or any doctor's office. The most important thing is the patients connect with it, provide access to the clinical information or to their day-to-day behavioral information, whether that be exercise, whether that be diet, whether that be their blood pressure and other kinds of things. Patient-reported outcomes are captured, so you can really see how people are improving on their emotional scale, how people are improving in their physical scales, so as to understand what's going on. In addition, OSG uses a technology, an algorithm called ACE-MAP, and this algorithm allows us to understand the deep motivations for what would make nudging be more beneficial, how to design these nudges. So what's the right message, what's the right medium, what's the right point in time or the journey. And based on that, we are able to segment the individual, identify them as being those that may be more difficult in terms of how they engage. They may be avoiding medication, they may be avoiding taking care of themselves, and the type of nudge that needs to be deployed may be very different than someone who's very much a strong believer in managing their lifestyles and how we handle them. ACE-MAP's a great algorithm. It's a one where the individual, the respondent, the person who has the app, is able to provide inputs and information about how the outcomes they desire to achieve, the kind of inputs that they would see, the type of nudges that they would want to see, and the kind of medium or the frequency with which they would like to be nudged in order for them to be kept engaged in their care. So I'll stop right here and turn it back to Ashley, but fundamentally, what we do is bring all of this data together, be able to analyze it in real time using artificial intelligence, machine learning, but be able to also design the nudge, personalize it for each individual, because each of us is special. Each of our veterans are special, and the ability for us to design that nudge specifically to that individual and to be able to deploy that in real time leads to much far better outcomes than to make a one size fit all or fit everyone. Ashley, let me turn it over to you so we can open it up for more questions from our audience.
Yeah, sounds great. Let me see here. Right now, it doesn't look like we have, I guess we have a couple.
So Ashley, let me kick it off with some questions.
Yeah, sure, go ahead.
And then as time progresses, I'm sure we'll have others who may want to. So this is a question for Ginger. And Ginger, as you think about the areas to support our veterans and those with mental issues that you deal with, what might be some of their specific needs? What do you see as some areas that we ought to consider focusing on to make it more beneficial to engage our veterans as they come out of military duty into more civil life?
Well, thank you for that question, Dr. Sukumar. I think peer-to-peer interaction, having these conversations with your peers, having folks who have been suicidal, to talk to folks as they are transitioning out of the military, because then you have these real world stories. And a lot of times veterans may feel isolated. They may feel that they are the only ones feeling suicidal, which is probably so far from the truth. So I think, having these difficult conversations in areas that may be free and inviting, maybe over like a coffee conversation, something similar to that. But I think it's important because when Mark was talking about his friend, I remember seeing that, and Mark, I'm so sorry, but I remember seeing that on social media. Like I'm Navy, so I didn't know who he was, but I'm attached to like a lot of Army folks who went to West Point on Facebook. But it just goes to show you how that message gets out on social media. And to your point, Mark, nobody said what happened. They were all just sorry that it happened, right? And nobody wanted to discuss that elephant in the room because Rob was such a giant amongst us. You understand? But if we could have had a conversation amongst giants, one of the things I find it, and I think I'm probably going to even write a book, like, where do we go as leaders to lick our wounds? Society has this thing where if you served in the military, you have to be tough. You can't lick your wounds in the open because it's a sign of weakness. And in all actuality, it's not a sign of weakness to lick our wounds. So to your point, and to answer your question, I think we have to create these atmospheres where it's okay for leaders from the top down to say that I'm not okay, that I need help. And I think that would really start the momentum to diving into, this issue that we have with veterans and suicide.
That's great. Thank you. Thank you, Ginger. You talked about engagement and mindfulness. I have a question here from one of our audience. It's from Travis, and Travis says, I found that mindfulness-based stress reduction to be really helpful for depression and anxiety. I've heard things like meditation, transcendental meditation, good ways to get people focused in back to their life. Can you give an example of a nudge that might encourage this behavior, and I would assume encourage people to consider mindfulness-based stress reduction, whether that's meditation or other mechanisms. Dr. Beidas, any thoughts on that? And we'll open it up to the other panelists as well.
Yeah, that's such a great question. So, there's different mechanisms through which to engage people with evidence-based practices like a mindfulness-based stress reduction or cognitive behavioral therapy if they're experiencing depression and anxiety. I think, one of the ways we might think about designing a nudge, and we would want to go about it in co-creation with patient stakeholders and evaluate it, would be pushing, for example, a message to somebody if the phone is sensing a change in behavior. So there's a lot of great cutting edge work. Some of what was spoken about over the course of the 4 brief talks about using, for example, a smartphone as a passive sensor of behavior, the phone recognizing that maybe something might be off, the person's in bed longer than usual or isn't reaching out to other people, and then pushing a message to nudge someone to pick up their mindfulness-based practice. My watch does it all the time. It sends me messages when I haven't gotten up, or I don't actually know how it knows. It tells me to take a breath. And it's not like I have to go log into the app and then do the thing, right? It's push. So that's an example of a nudge for that.
Very good. Mark, any comments on that?
I would just add to what Dr. Beidas said and agree. And I think the environment where individuals operate and exist the most is where we must meet them. And that is the phone, that is social media, that is external to a medical facility. I think the nudges via smartphone, passive or active, is a very ideal solution to be able to tackle the problem before it becomes a crisis.
Mark, since we're on the topic of apps, I have a question from Lydia in our audience, and she says, the VA Medical Centers uses telehealth. The app that was discussed earlier simply reinforces or nudges veteran users. Is there a free app? If not, how do the veterans pay for the use of the app? My apologies if I missed this information in the beginning. I'd love to hear from you, Mark, and then I can talk a little bit about it as well in terms of just how our app and our nudging technology can be made available as such.
Absolutely. What I will say, not to get ahead of some official announcements that are coming out, is that in the coming days, in very short fashion, veterans will be able to receive technology that will place it in the palm of their hands at no cost. And they'll be able to download and leverage and use it. So without divulging information that I can't share at this point, they will be able to get it without any cost. And the Department of Veterans Affairs is fully behind making sure the veterans gets the absolute best from their app stores, from telehealth, and from partnerships with the IT community.
Thank you, Mark. And Dr. Beidas, I have a question for you just in terms of talking about apps and how we engage with apps. How do you see these nudges being deployed? What is the best place? Is it at a point when, and I know you've done some research in this area, when you think about the continuity of care and a veteran or an individual walks in to see their physician, at what point do you start to engage them? And at what point is it most appropriate? How do you even take someone who has not been diagnosed to have any of the symptoms, in a pre-diagnosis stage, and how do you get them engaged to be able to identify what's the right point in time to nudge them?
Yeah, absolutely. Great question. So one thing I just want to anchor us on, and I think this theme came out so clearly in everybody's brief comments, is that we're all aligned on the mission that we want to save a life, and that saving a life leads to saving many lives. And, that is the whole point of why we're here today. And so I would offer that we should be thinking about these approaches all along the continuum, because each point is a lever where we can achieve that mission of saving a life. And I think about this from the public health approach. So, there's the universal kind of first step where, you're engaging in prevention. So for example, if someone has firearms in the home, securing them safely to put space and time between lethal means. And then the next step up on the triangle of the public health continuum is targeted, or for people who are at risk, who might be experiencing anxiety or depression symptoms, but aren't quite at a clinical diagnosis. There's evidence-based approaches we can push then. And then the final top of the triangle, which is folks who need more intensive intervention, where we can deliver established evidence-based practices for suicidal ideation or behavior. Now, if we can catch more people upstream before we get to the top of that triangle, we're going to be better off in achieving our mission of saving as many lives as we can.
Great point, Dr. Beidas. And so here's a question. I think it's a combination of one that I'd been thinking for a while, and one from Christine and our audience. It has to do with family members, and can family members come and talk to someone about ways to have their loved ones get help? Can they also get access to the app? I know in the case of our app, if the individual provides permission, the caregivers can get access to the data as well. But Christine's point is sometimes the veterans are just too proud to tell someone they're depressed. Will they have features that they can get tips or have a chat feature? And so for me, it's also a question of, where do you initiate such engagement? And Mark, I don't know if you have some thoughts around this in terms of what IBM's doing. I know what OSG is doing, but what IBM's doing, is there a way to get care, I'm going to call them caregivers or family or friends, also participating in supporting the individuals? And are your apps able to do that?
The short answer is yes. What you will hear here in a few short days, if you stay tuned to announcements that will come out from some major organizations, will be something that's available to veterans, family members, and caregivers. Veterans, family members, and caregivers. So the short answer, in simple, is yes. In order to tackle this problem, we must resolve that access problem. And so we don't resolve that access problem by restricting it to just those who serve, because they're not the only ones that's suffering through this crisis. There's a whole team of caregivers and family members that are experiencing this with veterans that are going through. And so the short answer, yes. In terms of engagement, I would move it back up the continuum in like fashion as Dr. Beidas. And I talk about this all the time. There's a great amount of concentrated resources in the crisis zone, the evidence-based medicine, those things that result in an ICD-10 or a CPT-10 code. There's a great deal of resources there. But what if, and what we started back in 2016, if we were able to move far back up the continuum before spiral, before ideation, before crisis. And I think that is the point of where we develop and shore up and fortify one's resilience, is before they even get into crisis. So the further back up that continuum that we can go, pre-spiral, pre-crisis, the more efficacy we can have in preventing the spiral. What is it that's back up the continuum, pre-spiral, pre-crisis? The social determinants of health. If I can't get employment, if I don't have housing, if community and social isolation is a major problem and factor in my life, then I'm starting to sort that is a precipitating factor for a spiral or crisis. So if we can engage that far back up in the environment that they exist in mostly, which most of us carry our phone around or social media, wherever we're operating, if we can gauge them at that point, pre-spiral, I think we can have tremendous success in combating the problem.
Thank you, Mark. And Ginger, I'm going to ask one more question on that topic before I switch to a slightly different topic about designing nudges. And I thought I might ask you this. You heard Mark and Dr. Beidas talk about access and access points. But even if access points were made available, and if they were made available much more upstream, how should we look at initiation? How should we look at getting people to, do the simple act of downloading the app or getting initiated? What, in your opinion, would be approaches that we might consider to get that initiation going? Any thoughts on that?
Oh, absolutely. You know, one of the things that we pride ourselves on at Women Veterans Interactive is meeting women veterans at their points of needs. We go into the communities where these women veterans live, work, and play. You know, we have designed our outreach in such a way to where it's very open and inviting to the woman at heart. And then once we grab you by the heart, we grab you by the mind and give you all of these tools and resources that you need. So, it's just a matter of how you outreach and engage. I wouldn't recommend saying, some people, I love the whole concept of nudging, because if you say, are you depressed? Are you suicidal? Most folks are going to say no. They're not going to own up to that. But if you're in an environment where it says, okay, you know what, we have this app. Did you know about this tool? Like in an indirect manner, in a nudging manner, present this to someone. You make these tools and resources available, but how you present it to a veteran, I think is going to make the difference. We have never had a problem reaching women veterans with whatever we wanted to do, because, we support the woman based upon her service to the country. So, what is that real need? How do you really get them through the door is going to make the difference. And this is why I'm excited to continue this conversation about the nudging, because it's like a soft tap on the shoulder. And then you look and it's just like, I can reach out to this resource confidentially. Nobody's going to know that I'm depressed, but I know I need help. So I'm going to reach out because it's confidential.
Great. Thank you, Ginger. And I got a question here from Nicole, and she says, and this question may be Dr. Beidas, you could take this one. How did you conduct research to find the effectiveness of nudges? And there's a second part to that question, and I'm going to add a word to it. It says, and ensure its efficacy. I'm going to say ensure both the ethics and the efficacy of it. Any thoughts on that?
Yeah, absolutely. And one thing I should say is that nudging in suicide prevention is in its infancy. So this is kind of cutting edge work. There's work going on in this space, but if you do a PubMed or literature search, you're not going to find a lot of stuff. But if we look to the broader literature and we think about how we establish efficacy and effectiveness, typically the ways that we do it are through randomized controlled trials, where we randomize some people to get a nudge and others not to get it. And then we look at the outcomes that are matched to the research questions of interest. In terms of ethics, it's such an important point. And one thing I just want to highlight for folks is that we're being nudged all the time, whether or not it's intentional. Our environment shapes our behavior, whether or not it's designed in such a way to do so. And so we might as well leverage that fact and design it in a way that ensures the best interests of the individuals who are in that environment. But there are lots of questions about ethics, and there are scholars whose entire research programs focus on the ethics of nudges. One way that I manage this in my own work is ensuring that I co-create any intervention or nudge with the intended population and see folks as equal partners in that work. And so in that process of co-creation, which, I think Ms. Miller described it very well, meeting people where they are, understanding their lived experience, and how we can work together to apply the science in such a way that's effective. And then you have to measure it and make sure that that's accurate. So I think that measurement and evaluation piece is critical. So thank you, Nicole, for asking that question.
Great. Thank you, Dr. Beidas. And in OSG's app, we use ACE-MAP, which is slightly different than an A/B testing that allows you to actually test many more nudges simultaneously and identify which one is more valuable to someone, more important, getting them better engaged. And this is an algorithm or technology that's been published and has been used quite extensively in demonstrating a deeper understanding of behavioral intent and behavioral engagement. One last question, and then we can look to wrap it up. And this is around just looking at success measures. What should our audience think about when we think about success measures from nudging, or success measures from the use of the right technology, the right medium, the right messaging, the right frequency of messaging, the right point in the continuum, et cetera? What should they be thinking about when we talk about success measures? And I'll throw it open to everybody here on the panel to respond to that. Dr. Beidas first.
Sure. I mean, it really depends on where you are in the continuum and what your question of interest is. So if you're in the universal bucket, we're thinking about resilience, wellness, engagement with community. You know, if you're in the secure storage of lethal means, if you're in the middle, kind of targeted at risk bucket, then you're thinking about you know, whatever the risk factors are, if they're depressive or anxiety symptoms. And then if we get up into the kind of intensive crisis, we're thinking about suicidal ideation, behavior, engagement. So there's you know, the world is kind of your oyster in terms of what you might measure. You just have to measure important variables based on where you are in that continuum and what you're trying to, what type of behavior change you're looking for.
Thank you, Dr. Beidas. Mark?
One life at a time, and then another, and then another. I think that is the overarching end state of suicide prevention and nudging and technology. It's a crisis that we can't take our eye off the objective. Subsequent to that, there are many measures, wellness and mental health improvement, all of the things that Dr. Beidas iterated. Those are real things. But I think our overarching measure, at least what we set out to do, was one life at a time, and then another, and then another. Thank you,
Mark. Ginger?
I'm just going to say I'm smart enough not to come behind Mark, and I'm going to just echo what he said. You know, one life at a time, and then another, and then another.
Very good. Well, thank you very much. With that, we are almost out of time. Ashley, I'm going to turn it over to you for a quick wrap up for us.
Yeah, no, I think this is great. I just wanted to say, Ginger, Mark, do you think we could put some information out there that if it seems like I think some of the participants might know somebody that needs help. You know, they're probably looking, you know, how can I help my friend, my family member? How can I get this app? You know, people do attend these webinars, you know, because they have a personal, you know, situation, right? So that's what I'm wondering. And so maybe if we can work together and put some information out there that would kind of help direct them and help guide them. I think also too, Mark, like, you know, maybe we can have another webinar to kind of talk about the technology that you have at IBM that will be free to veterans. I think that would be an outstanding webinar along with the rest of the team here. And I think one thing we kind of maybe skipped out on maybe is talking about the data analytics part behind these applications and how much data can really, you know, drive the way we help individuals in prevention of suicide. And last but not least is I think getting this information, teaching it in school is important, right? Because when you have a crisis, I personally would not know what to do because I don't have the tools and experience or the know-how to figure out what to do. So then you go into depression. So I think before crisis hits, you have to have the training and the education. So maybe that might be kind of idea that the school systems need to kind of start teaching this, especially with the scenario in COVID and that kind of thing. But anyways, just wanted to say thank you very much, everyone, for attending this webinar. I think it was outstanding and really appreciate the panelists' time and insight. And thank you very much. Have a great rest of your day.
Thank you.
Thank you all.
Thank you.